All right, so we had a good response, 524 folks. Gives us enough people to be able to disaggregate a little bit and show results for who answers by race and some other categories. You see about 70% of folks were listed as Hispanic or Latino, Latina, and about 22% white or Caucasian, a smaller percent for all the other groups. In terms of the demographics, in terms of socioeconomic demographics, about 43% of folks were in the less than $30,000 annual income. Another chunk of folks were in the 30 to 50K, so that's another 20%. So talking about 60% or so of folks were below the median income of the of Chelsea, which is actually really good because often when you do this kind of survey, you don't get responses from the folks most in need. So kudos to the team in Chelsea and our friends from Green Roots who did some of that, the health ambassadors and outreach to get such a good representation. This is the breakdown by how folks identify themselves, household size, and whether or not they have children in the house. A good number there. And obviously in this last category, there are people who had children under 5 and children 6 to 18 in the house. That's why there's overlap in those numbers. About 70% of the respondents were women, not too uncommon that you get a gender grouping that way. Let's look at some of what we got. A big piece of this was that the financial impact of COVID-19 on the respondents was quite striking. And so this one is, we asked what the change to financial situation was since the beginning of the pandemic. Orange here means that your financial situation is worse. And so for folks making less than 30,000, 80% of them said that their financial position was worse, situation was worse. For folks making 30 to 50, more than half of them, and even for folks making 51 to 80%, 45% of them said that their financial situation was worse than it was before the beginning of the pandemic. Not surprising. And then this last column is overall. So overall respondents, more than 57% said that their financial position was worse than it was before the pandemic. Next, we asked about difficulty paying household expenses in the past 3 months. Again, folks making less than $30,000, more than half of them said that it was very difficult. And another 37% said somewhat difficult. If you go to folks making 30 to 50K, about 30% very difficult, and nearly half said somewhat difficult. So we see a large group of folks here, 300 out of the 500 respondents who said it was either somewhat difficult or very difficult, with a large amount of those being in the very difficult. And when you look overall, about a third of the folks said it was very difficult, and another little bit over a third said it was somewhat difficult. So we know that folks are struggling. What question that we asked was folks' confidence and ability to pay the next month rent or mortgage, which is really about, like, are folks really feeling like they're on the edge? And you see that the not confident is this blue number here. Folks who are making less than 30, nearly 48% of them were not confident in being able to pay the next month's rent or mortgage. That went down to 21% for folks 30 to 50, and about half the folks in that somewhat confident. And again, this is a large number of the folks in the survey who had the not confident. Show you a couple more of these. We started to ask about major areas of concern: affordable rent units, food security, childcare, environmental health were near the top. All these other sections pretty, grouped together. There's a lot of concern on all of these. They're very well represented in what we've seen in the focus groups and key informant interviews, and also in some of the work that you all have shared with us. When you look by the major ethnic groups and racial ethnic groups in the city that we can really break out for Hispanic and not Hispanic, there's some telling signs about what folks are areas of concern stand out for them. Most of these open space, affordable home ownership, and community space programming are close together, grouped together. Environmental health has a little bit of more separation, with the non-Hispanic population being more concerned about it. It flips in terms of affordable rental units, Hispanic, Latino population, a lot more folks concerned about affordable rental units there, and behavioral and mental health a little bit more so for the Latino population, but high for the white population as well, or the non-Hispanic Latino population. Any questions on that one or the previous slide? Comments? All right, the next two slides are give us a sense of top 5 areas of concern by groups. And what you notice is, I want to make sure that folks notice that under 30K is nearly 40% of the people answering the question, another 20% in the 30 to 50. So 60% of the folks are in these first 2 columns. And then folks making more than that, 51 to 80, 81 to 100K, 110K, 100K over are in the other ones. These quintiles for the city don't necessarily fit the the median. The median is around here, so we have more people below the median than above the median. But what you see here are some of what we've seen: affordable rental units, behavioral mental health, environmental health, open space creeps in here. Environmental health is big across the top in the higher income areas, but still really important here. And we see community space and programming important in all of these. We start to see affordable home ownership in these spaces, but obviously that's folks who are making a little bit more and are trying to see about owning in this space. These are the top 5 areas for concern. And then the last one, and this is just that version in Spanish for folks, the same exact graph, just in Spanish. And you did get a copy of this, so feel free to take a look at it. One of the other things that we did was there was an open question about ideas and what was important to folks. The most frequently used words were, of course, Chelsea, that makes sense, help and needs, but also housing, community programs, affordable rent, streets, park, and food are some of the things that came up from the folks when we asked them what was important and any additional ideas for how these dollars should be spent. So that's a little briefing on the survey. We'll have a lot more of a deeper look at this for y'all in the kind of more official reporting of it, but we wanted to give you a chance to take some of that in as we start the conversations on some of the strategies. Any questions on any of this before we move forward? Seeing none, I'm going to move us forward here. I'll stop sharing that. So hopefully folks had a chance to take a look at the what we sent out as a strategy review document. It just captured the strategies that we've been talking about throughout the process, and the strategies that came up in the last meeting, some strategies that came out of the focus groups and kind of community engagement. And what we're going to do today is really simple. We're going to look at the strategies, see if there's anything that folks want to edit or add to them, do some advocacy, and then we're going to ask you to rank the strategies in order of importance for investment. All right, so you'll be able to look at all of the strategies in one category, and then we'll ask you to rank them. You'll be able to do that using a piece of software or a program called Poll Everywhere. So we'll put the link up and give folks time to do that. We're going to do this in about 15-minute groupings like we did last time. So we'll look at the strategies, review them quickly, see if there's any additions, open it up for people to advocate for strategies, much like we did last time, and then we'll move to the ranking. Any questions about the process? All right. I also want to mention that this is the initial ranking process. From here, the results will go to the community meeting on March 2nd. There is an opportunity to get some input from City Council, and then we will finalize them a month from now on March 16th when we get back together. All right. There aren't any questions. I'm going to move us to the first category, which is small business. This is small business. So we have them in English and in Spanish. The first one is create an asset strong go-to option at City of Chelsea, able to give final guidance on policy and other issues affecting business. Support trainings for small businesses such as ServSafe, OSHA, financial planning and developing a strategic plan, potential minority business center. C is provide business incubation startup costs for small businesses. Jenny, I'll be right with you. Just want to read these into the record. Support. D is support at home daycares as small businesses, access to traditional and other programs and supports. E is increased availability of childcare through employer and employee supports. F is decreased barriers and additional costs for small businesses such as PPE, childcare accommodations that allow for safe functioning through pandemic licensing and permitting. And G is direct cash infusion to support small business. I saw a hand. Jenny, go ahead.
I think on B, the only thing I will add for that will be some sort of incentive program for small businesses that actually implement some sort of hiring within the city for residents or for students.
So, Jenny, that's in the workforce development one. So
okay.
Okay. No, that's good. That's good. I appreciate it. No, that's these are connections.
Okay, so that's already okay.
It's good. It's good. I appreciate that. Other folks, any comments, questions, additions? Roy, go ahead. And we'll do advocacy in a little bit. We'll start the advocacy in about 3 minutes. But go ahead, Roy.
I may have missed this. Again, I'm coming late to taking Naomi's spot here and stuff. But
no worries.
Was there a definition?
Perdón que llegue tarde.
Was there a definition of
¿Hay alguna petición?
Number of employees, gross sales, all of that? What are the definition for what a small business is?
Okay. I don't believe that we had one that was different than the definitions that the city has used for its programs. So that would kind of be in alignment with the definitions that are being used there. I don't know if Alex or anybody else wants to weigh in on that. I am hearing you, yes.
Yeah, that happened. So sorry. With the
okay, let me see if I can do something about this.
No sé qué es lo que está pasando. ¿Me pueden escuchar?
Hold on, I'm trying to find Marcella. Okay, Marcella, you should be in.
Ah, okay. Yes.
All right.
Do you mind if could Roy just repeat what he asked?
Sure, go ahead.
Please.
I could tell you what he asked about was there a definition of small business, either by size or amount of money taken in, or some other definition? And what I said is that we didn't really do a definition of it. There is obviously the definitions that the city has used for their businesses supporting their program supporting small businesses. And so I would assume that this would align with that. I don't know if any of our city officials want to jump in on that.
So, hi, Roy. I guess what I would say is that depending on what strategy was being implemented, we would be looking for additional funding from other sources, and we would use their definitions as appropriate. Typically, a small business is somewhere around 50 or fewer employees.
Thank you. Great question, though. Appreciate that. Other folks, any, go ahead, Roy, sorry.
I'm just curious because, again, I would wonder if it's also about including sales volume, because you may have a firm that is small and under the 50, but as far as sales volume is tremendously high. So a curiosity, I would think that there'll be a additional measurement that would include sales too, so that we are trying to help actual small businesses that, you know, don't have high revenue source. So I would say should have both.
Appreciate that. And I think that's the kind of stuff that we want to make sure we keep informing folks. And it's not just high volume of sales. You're really talking about revenue that turns into profit. And so, you know, you could be high volume and still be operating at a loss. So absolutely, you want to make sure that folks actually need the help you're giving. Appreciate that. Other folks, any other comments on these strategies before we ask for advocacy? Any advocacy, anybody want to advocate for? Go ahead, Alice, go ahead.
Yeah, I have a question because when I see B, support trainings for small business such as et cetera, then I'm thinking of the training option, because that's another category, right? So I'm a little confused.
So there is workforce development training that's in the workforce development set of strategies. This is for businesses. So think about it, this is like for the employer, through the employer, as opposed to workforce development that would go through the employee or through the potential employee. Okay,
so this is the ServSafe, it's supporting the employee, but it's really going to support the employer to help with the employee.
Exactly, for them to be able to have folks in there. Yep. Jenny, you've got a hand up. Is there an advocacy that you would like to do?
No, can you just repeat that part on B? In terms of this is for the small business to do versus.
So this is for the small business. So think about this as like these supports that go to the small business, and workforce development is supports that go to the workers. That's kind of the way to think about it. Yeah. I mean, obviously this would benefit workers as well, but this is the intention is to support the small businesses through here. All right. So I'm going to ask us again if there's any advocacy, if there's any. And it doesn't have to be, but if there is anybody who wants to speak for a specific strategy before we take our first attempt at ranking these.
Can I raise?
Rick has a hand up, and then Raphael. Go ahead, Rick.
Well, as a small business owner, I think there's going to be other avenues coming up for like some some training for some of the employees, which may be more geared to workforce development. But as far as the small businesses, some of them may need help with maybe legal or accounting issues that will help them stay so that they don't have a problem with the revenue department, or they do everything, they get the right kind of insurances, they know how to operate a business. And I think if some money would be put into something to be fund, something, like a score or something local, that I think that would be beneficial for the small business owners.
Okay. I'm not sure I understand the score part.
Well, there's an organization called SCORE, which is retired executives that will mentor and help. But I think that's a help a lot of these small businesses need, and teaching them how they need to run their business, to run a bank account, make sure they pay their taxes, in a timely fashion, and know what their responsibilities are as a small business owner.
Okay.
As far as the employees, I think that workforce development will address those issues.
All right. I just added in there after financial planning, legal, business, and then developing the strategic plan, if that will help. So any other amendments or questions? Or Raphael, I think you were going to do some advocacy, hopefully.
Not really. I would maybe. I would. It's less about A, B, C, D, or E. It's more about like what lenses are we applying to all of these. And since this is the first one we're doing, I feel like I should bring it up here.
Go ahead.
I don't know. I feel like I don't want to be the only one doing this, so I want to raise some and invite others to join me. But I think we should think about a balance between short-term benefits and long-term benefits. I think we should think about maybe we don't need to think about whether other resources are available because of what Carl said, that the city's going to look into other resources if they're available. But I just want to, I want to put that out there that we want to stretch the money as far as possible. And then I think the third one I would raise is leverage. So anything that allows us to spend $1 and to get more than $1 in benefit, to me, is a better strategy than one where we just give out $1 and it's worth $1. So I'm not sure how to apply that to this particular list, but and I'm inviting others to add other lenses to look at this. But I'm interested in sort of thinking about this in a strategic way to make the money go as far as possible. Because $15 million, as I've said before, sounds like a lot, but when we start spending it, it is not.
Absolutely. Raphael, if you see any of those opportunities within these strategies, please call them out. Go ahead, Alice.
I was just going to add that for me, the lens that I'm trying to use today, and this is going to take practice, is looking at where do we invest to create a foundation so it could be sustainable for beyond the funding time period. And anything that we can do to create some infrastructure or some core that we can use over and over again and extend, or something that trains everybody who needs it, and then that solidifies their experiences over the next few years. Something in that approach is what I'm looking for.
Great, thank you. Paul.
Yeah, thank you, Mo. Just to follow up with some of the things that have been we've been talking about. So again, speaking on behalf of the chamber as its current president, that's where I think a lot of focus, because everything here makes perfect sense. I mean, we're already in the process, and it is we've been lucky to partner with Good Jobs Coalition, the Hispanic American Institute, to receive some funds from the Community Empowerment and Reinvestment Grant. However, it's short term. It all has to be created, implemented, and spent by June 30th. And those are allowing us at the chamber, which should be the epicenter of all of this stuff that goes on here. But we need that, as Alice just said, that continuance, that foundation. I believe the chamber is that foundation. Mm-hmm. I think when we look at, we are in the process, actually, our past president, Joe Bernard, has been in contact with Alice, and we are about to do the, some training in partnership with Bunker Hill, with one of the grants we're receiving. And those are the things where we look to, you talk about that sustainability, or Raphael, that $1 for $1, where these classes cost a good chunk of money. But we're only, just on the administrative side of things, we're looking to sign employers up for like $10 or $20 per person, even though it costs $150 to $200 for the training. And that is a benefit to be a member of the chamber, is that we're going to either partner with Bunker Hill, where they have to do ServSafe to do the training there, or like we're working with the Hispanic American Institute on the Minority Business Center, is that we're going to host all of the trainings and coordinate all of the trainings and have guest professionals come in here. So on that advocacy side, I do believe the chamber is that with the business, I mean, with a storefront right in the downtown of the city.
Paul, I don't mean to interrupt you. I'm just going to ask you, is there a strategy here, a set of strategies here that you would say more aligns with what you're bringing up? Is there anywhere in here that you would want to see more investment in? That you want?
Well, yeah. Basically, it is the support of the trainings. It is that
Right,
support of the. I mean, we already have support. We already signed on with a consultant on a strategic plan that's going to begin in March to create a 3-year strategic plan. But when we look at some of those, the trainings, the OSHA, the ServSafe, the banking, some of the, as Rick brought up, some of the newer, we get English as a second language for new minority business owners. Those are the things that we're looking. So for that sustainability.
Okay, great. Thank you. Appreciate that. If there are no other advocacies, we're going to take our first strike at this. Thank you, Jenny. Appreciate your comment in this, and I see your advocacies for A, B, C, D, F, and G. Appreciate that. I'm not sure what E did to you, but we'll go with that. I'm going to ask you to do something. No, I know. I'm just playing. What we're going to be doing next is you're going to take these strategies and you're going to put them in order at the top as the most important from your perspective for investment, and then declining in importance going down. You're going to use a program called Poll Everywhere. Erica has just put it in the chat. I'm going to stop sharing my screen so she can share hers. And you'll each be able to go in and do your own voting. So workforce development. We have create asset. Sorry. There we go. All right. Provide subsidized training in critical areas, including trades where employment is available in Chelsea and nearby. Subsidize these trainings with stipends, transportation, childcare options, and address cliff effects. Create a portal for Chelsea business and / job opportunities. Increase workforce development for those most in need, the undocumented, and opportunities for youth. So that's 3 groups: those most in need, the undocumented, and opportunities for youth. Engage businesses who commit to taking on less experienced employees, such as apprenticeships. Provide access, flexible English language classes, including industry-specific pathways. Subsidies for public transit, and access to high-speed quality broadband at internet at prices people can afford. Any additions that folks want to make, or comments, anything that you see is missing that we want to get in there? Jenny.
Sorry, I always have something to say on everything.
It's all good.
So, okay, so I'm going really good with A. I think that on number, I think it's letter D. It says engage businesses to commit to take on less experienced employees. I think it needs to go a little further, and there has to be some sort of incentive for a small business to actually not only create those apprenticeship, but have something that it could be a mutual, you give, you get. So we all here for Chelsea. I'm going to help Chelsea, and I'm going to train residents, and I'm going to hire residents. So it's almost like give, not just give, but it's a give and take sort of thing. So I think that's missing on that. I will say on the provide accessible, flexible English language classes, I think that's great, but I think the most important part is creating industry-specific pathways, especially for the youth, those that are in high school that are undocumented or that probably don't have a way into going to college, to be part of some of those apprenticeships. So that is something that we need to lining there together. the next thing is, high-speed internet is great, but I guess I'll do my vote on that one. I don't know how important it is besides other options such as, additional resources and trainings that could be potentially for youth and children's after school. There are other ways in which we can improve besides high-speed internet.
Thank you. Kara?
I would just add, I think behind the high-speed internet, because there's a piece that I think is important about it, and it's just equitable access, but people also need access to computers. Like applications to have to do those on phones is impossible and ridiculous. And so I don't know if that even falls under workforce development, but to have some sort of computer lab access for people to have access to computers, like come use a computer and a printer. I say Chelsea Community Connections all the time for that, but really one computer and one printer is not sufficient for the entire city. And to have that more accessible for people, also to communicate with each other, but just the education and learning piece. Thanks.
You. Roy, Alice, then Joan. Roy, we can't hear you.
Sorry, I want to follow up with what Kara said. Reading A, reading B, and C, and then an E. The manner in which today's world is working is to do it by laptop, by phone, and if the access to the internet is the barrier to those A, B, C, and E, then you're not, then that those efforts are somewhat muted and cut. So I was reading down the list, I'm like, those are all great ideas, but I think that to maximize the potential of offering that, G ends up coming to the top because that's 21st century requirement. And when I look at repeatedly the level of high-level access, high speed access in our community, and what the private market is offering, because the prices are so are higher, or there's not as much profit for them to offer it in our community, they fail to do so. So I would definitely rank G a little bit higher, only so that we can get the rest of those projects done. So
Awesome.
I concur with what Kara had just said.
Slipped in some advocacy in there, so that's good. I appreciate that. Alice, then Joan.
I'd like to add to this. When I read across several of these, I keep thinking that there are some core areas where we need to be able to offer training, free training for all on some foundational areas. And when I look across the list, I think of foundational areas as IT, yes, the computers and high-speed internet, but the IT, being able to have those skills and a series of training sessions that elevate the skill level, because even to work now, you have to have some basic skills with technology. The foundational skill of ESOL, English language learning training for everyone, that should be free and available and infused so people can get to work and be able to move up with jobs. And then the other piece that I see here is critical areas, but also let's not forget, we mentioned it before about childcare, treating them as businesses. Well, let's have some free training, foundational training, so that those who are offering this small business get the free training so they're fully certified and our children are safe. So I think foundational training in ESOL and IT and early childhood development, all of those I think are going to be critical. And I kind of see them in different places, but it's a bit confusing, because when I read A and C, I'm confused between those two, because they are both looking at workforce development. They're just targeting different groups with different resources, but they're so related, it's hard to choose between them.
Thank you, Alice. Joan.
Hi. So I agree with Alice in terms of age and just having that foundational training to prepare, residents and youth that are coming out of high school that are not documented, that are not going to college, to prepare them to succeed in the trades. So I started with the trade saying it is fundamental that we implement such programs in our community, because the reality is many of them don't go to college and they need that trade in the trades in order to be self-sufficient. But I do want to add that I think we can work some type of entrepreneurship piece into this setup as well in terms of workforce development, just to add to training and upskill, but just adding that entrepreneurship piece, because residents have great ideas, but they need a help in getting that start. So just reinforcing entrepreneurship as well.
All right. And y'all are gonna see that my English is my third language, so it showed up in my spelling there. Paul.
Well, yeah, just wanted to follow up with what Karen Roy said in regards to G. Here just specifically at Chelsea Housing, looking at the 914 units all built in our 5 family sites that really are affected by this, are built in the late 1940s, early 1950s. We are working closely with the city of Chelsea, with Alex and Metropolitan Area Planning Council and Cal on this innovative program to bring Wi-Fi accessibility free, to the residents up here at 2 of our biggest sites, to 200 units of ours that we're going to begin doing. But and how we found this out is that we have 2 self-sufficiency programs, one for our federal families and one for our state families. And as we speak with them, especially during COVID, they talked a lot about when, again, another partner of ours is with Raphael and T&D and Connect, is that they did a lot of the program virtual. And so what we have done is we created an office that Kara comes up and visits, and we have, purchased, tablets in that particular office, so residents can come down and use the tablets to apply for jobs, to do some of the training courses that some of the partners, offer. So I do believe that all of these are terrific ideas and very important, but I do believe G, does need to bounce closer to the top, looking at today's world.
Awesome. I really appreciate folks' advocacy and clarity of it. Anybody else want to advocate for a specific strategy before we move to ranking? All right. We'll be doing that same process. You're going to get a new link to go to. So please close the other one that you are in, and then we'll go to the new one, and it's up. It's in the chat. Erica's put it there. So Erica, I will turn this over to you. We're going to go next to housing. And so again, the same idea as we're wanting to reflect on the strategies that are there, make any comments or edits, and obviously if there are anything that's missing or anything that we want to add specifically. I'll just read these into the room as you're going. A is support housing stability initiatives and programs such as Chelsea Eviction Task Force. B is make investments that leverage and multiple and additional resources to expand capacity for housing stability services, including support for residential rental areage. Support rent. C is support rent increase mitigation, rent control, long-term rental assistance incentives for landlords to not raise rents. D is increased new construction of affordable housing, mixed income housing, new sustainable models. E is increased redevelopment and rehabilitation of available housing stock to create healthy, comfortable homes. F is increased equitable housing opportunities based on resident needs, including affordable housing, public-private partnership, workforce/middle income, and 80 to 100%, 120% AMI housing. Home ownership programs, G is home ownership programs for current residents, including rent-to-own opportunities, interest rate subsidies, and down payment assistance. And H is create housing specifically for civil servants and community-based organization staff to live in the city. So those were the strategies that came from lots of the comments that people made, and also from listening to what folks had. Just seeing if there are any comments or anything, any edits or additions to what's here. Is there anything that's missing? Is there a strategy that you think is not represented here?
Can you explain F?
Yeah, that was my
Explain
question.
F. What we heard was increasing equitable housing opportunities based on resident needs. So looking for affordable housing and in all the different ways that it's been made. So the public-private partnerships that we're doing, housing that included, I'm going to use the wrong words, Paul, so correct me, where you have housing for folks at different income levels in the space, in the same space. That's been a model that's worked. Workforce and middle income housing, so that's not just affordable housing for people who are under 30% or 50% AMI, but also affordable at every level, so the 80 to 120% AMI.
So how is that different from D? Because I see that in D as well. I interpret more in D, and it's comparable to F.
So there's new construction and there's redevelopment and rehabilitation. Those are the differences between D and E as I see it. And then F doesn't address the construction part of it or the rehabilitation. It's the opportunities.
I think if I recall, some of F was based on that discussion around people that were moving out of Chelsea because it wasn't affordable for them, but that they were homeowners, or it was affordable, but now it's not affordable for them. So the holding on to residents that have been there a long time but are now moving out of the city. I may be wrong, but that's how I'm kind of interpreting F.
And we can, if there's some advocacy to put some of these together or to go with one or another, we can definitely do that as well. I see Jenny and Roy.
I gotta say, I actually love F because it's basically affordable, affordable rent or ownership for all, regardless of your AMI. So I think it's phenomenal. Something like that. I will say that on D, I will go as far as increase new sustainable models, because I know we'll touch on environment and all of that, but I think that's key, especially with Chelsea. It has to be sustainable models that take into account, the environment, also the rent issue. And that leads me to my number one, which is the support of rent increase mitigation. And I'm hoping this is not just for residential, but also for commercial, where landlords forget that it is Chelsea, it's a gateway community. We shouldn't be paying the same prices as downtown Boston.
Thank you, Jenny. Roy.
All right, I had to unmute myself. And again, seems to follow up what Kara's trying to touched upon earlier. I know I sound like a broken record when it comes to this particular issue. And I'm finally seeing the shift both at the federal level with HUD now, pushing home ownership. And the Governor Baker saying the same thing, that he wants his efforts in the state with the state agencies to push for more home ownership. And the levels that we're talking about, that 120. As a experienced realtor, I spoke about this. Right now, the price points for a single family home in Chelsea are to qualify for those homes as a buyer from a mortgage. Your income levels are at the 150 AMI rate. And so much of the efforts of Chelsea when it comes to affordable is looking at one, primarily rental, creation of affordable rentals that we've seen in the last 10 years more than home ownership. And also it caps at 80%. Even our inclusionary zoning is only at 80% AMI. What we've been seeing, and everyone's been seeing, is basically the purging of our workforce here in Chelsea. Those who came in, started off in lower income and then progressed through hard work and are now making the income levels to go and buy a home, are finding out they can't find a place to live in Chelsea because everything is priced at the 150 MI. They are above the 80%. And quite frankly, hasn't been a lot of building of affordable housing in that for the demand. So yeah, my advocacy is we need to keep the people that we've been, kind of cultivating in our community here, workforce, our workers, our contractors, our municipal employees. We repeatedly on the city council are getting letters from the city manager asking for waivers from city employees who are buying a home elsewhere. Our entry-level officers and firefighters are saying, yeah, you want a requirement to live here, but we can't afford to buy here based on their salary, and there's no assistance there in that level. So I definitely want to see it open up to the realities of what who's leaving our community, that 80 to 120 range, because they are the Chelsea folks, and they've, are moving up in the letter, and it's again, economically, it's makes sense for this community to keep them here, retain them, because not only the community ties, but also that's a level of people, when we say what's going to support our businesses, well, those are the people that are creating wealth by owning their own home, have greater disposable income, and are going to be buying and shopping next door, i.e. supporting our local businesses. And it's again, a catch-22 of continual help. So again, I think that having these home ownership programs at the forefront and creating and building affordable in that range that is still under our current market rates would be beneficial long-term.
Thank you. Rochelle. You're on mute, Rochelle. We can't hear you.
I told you my life story. I was out sick today and I'm still feeling that. I just apologize for having my camera off because I'm still feeling a little under the weather. But I did want to add to it all the points that are made, all the everything that's written looks really good. But I didn't see anything about vouchers on a local level or some kind of housing certificates on a local level, like a Section 8 voucher program or a subsidized housing voucher program that we can use that for people that are already in apartments that they can't afford and folks that are struggling in that area. Some kind of voucher, like a local, like a loco program that we can run in Chelsea and have some vouchers set up, because the wait list on the current housing programs are astronomical. And it takes a really long time for folks to get access to subsidized housing, Section 8 vouchers. They're few and far in between. And I know that they put out probably about 50 vouchers since the beginning of the year, but the wait list is just way too long. And I'd like to see a voucher program on a local level. And then I wanted to also address the need for temporary housing for emergency cases. I mean, this is another area of housing where we're lacking terribly in Chelsea. We do not have shelters in Chelsea. We do not have any place to put these folks that are constantly, being evicted. So we need to look at structures where we can do, temporary housing, short-term housing for families in transition. And I'm good. Thank you.
Thank you. Okay, Paul, if you can keep it quick for me, go ahead.
Yeah, just wanted to, on F, it did fall under the conversation from our previous meeting, was the development that we're actually doing down on Central Ave, a public-private partnership that's going to have 96 public housing, 40 middle income, 194 market. But also just wanted to follow up with, what Roy was saying, as a former city councilor, and we work together on many of those initiatives, is the creation of more programs, for rent to own or lease to own programs, the availability of them for our residents, to keep them in here, and to whether it's more condo conversion that creates more home ownership opportunities. But that is something that we've been talking about for 20 years.
So we're going to make this J for housing vouchers and put temporary housing as a separate piece here. I'm going to try to make this fit. So we'll have I and J.
I would just add what Rochelle said too, or to just say, include the emergency housing situation, because I think we all see that too often.
Yep. Great. I'm going to give a minute for Erica to capture these last two additions in the poll, and then once she's done that, then we'll add it to the poll, and then we'll ask you to rank these. And I will ask folks to make sure that you rank all of them. Make sure you go through and rank all of them. And put them in the order of investment that you would like to see. So when Erica's ready, she'll put the link in the chat, and we'll be able to go from there. All right, thank you for that. Folks, you can see my screen. You can see food security. We have established urban agriculture infrastructure such as farmers markets, community garden, greenhouses, grants for residents to start gardens. That's A. B is provide education in healthy eating and how to shop in American grocery stores. C is increase food pantry and food assistance programming. Example, expand Chelsea Eats. D is develop a winter food distribution location and mechanism. E is engage local and small businesses in food assistance and food distribution programs. F is establish community kitchens and teaching kitchens. And G is provide access to food storage and kitchens for those who do not have access. So looking again for any thoughts on anything that's missing, any edits, anything that you want to make a comment on of these, and then we'll take some advocacies. All right, I've got Roy and Amanda. Roy.
I wanted to say something before Kara did, and she then could copy me now. So
that's how she does, though. You got to watch her. Big fan of Chelsea Eats. So I thought it was incredible. Obviously, as a volunteer of the food pantries, big fan of that. And I know that it has its place. So I am advocating for continuing supporting of that. And just recently, B, the article about a person of color walking into different supermarkets based on the income levels of the community highlighted what is promoted in the supermarkets that were high sugar, high calorie, low cost food versus healthier options when they went to areas of higher incomes. And we know that
it costs so much more money to eat healthier, but at the same time, we need, I think, a way to promote healthy eating in our community. And I think in order for that to happen, we actually have to start with our youth, who are then going to go home and maybe say to their mom, why are you giving me this? I want that. You know, sometimes it starts at that early age to make the difference. Because I don't know if the city, i.e., you know, our ISD or whatever, can go into any of these convenience stores and say, you know, hey, what are you stocking? You're not stocking, healthy options for our community. They're going to stock what really the buyers want to buy. But unless there's that demand for those healthier options, it's like, you know, chicken and egg sort of thing. But I'm more than welcome to hear from this group and others about how we can try to maybe change both the buying habits and the offering habits of our local stores so that our community does have healthier options in front of them, and how to address the high cost of those healthier options.
You did steal all of Kara's stuff there. That was amazing.
But so I just want to end, big fan of C, just don't know how to go forward with B.
All right. Amanda, Raphael, Kara. Go ahead, Amanda.
Listening to B and G, it made me think about like education for how to properly store some food, especially produce. It goes bad pretty quickly, and a lot of food waste, like one, you're wasting money, two, it's not good for the environment. So like education around food storage and how to like make it last, especially for those who don't really have like access to kitchens, like thinking about that.
Thank you, Amanda. Raphael.
I will get a reputation, I know, but I'm wondering if the way this is set up makes it easy for us to vote. It seems like C and D, the increased food pantry programming and develop a winter food distribution location, could be combined, whereas Chelsea Eats is a different approach, also a good one, but a different approach from the food pantry. And now they're combined, and you can only vote on, you know, you can only rank them together. You can't rank them separately if you prefer one of them. So I would propose splitting out the Chelsea Eats part and combining C and D otherwise.
So put increased food pantry and develop winter food distribution as one thing. Folks,
That's what I'm
amenable to that?
suggesting. And then
Anybody?
remove and make Chelsea Eats its own thing.
Something.
I
Okay.
agree, yeah.
I
Let's see.
agree.
Let's see.
It
Agree.
feels
Any-
like those two go hand in hand in terms of the distribution going with the food pantry
Okay.
distribution.
Let's go, Kara, Paul, Alice. Go ahead, Kara.
Thanks, because yeah, I think Chelsea Eats should come out as its own piece. I've been on the Chelsea Hunger Network for many, many years. And so we've been truly a combination of what Roy was saying around healthy eating, grocery store access, what's available for people, education programs in schools for sure happening. But then we also have 6 days a week availability of free food in the city, and people accessing that with a real need. Prior to the pandemic, how many food pantries were in Chelsea? 2 or 3? 2. So, and St. Luke's has been, you know, running nonstop from 300 families pre-pandemic to thousands of families during the pandemic. So part of the winter piece, as we've experienced another wave this winter, was around food pantries having to shut down because we didn't want people standing outside in food lines. So I think that was some of the difference in terms of what do we need an increase in food pantries? No. Do we need food pantry support and them operating 6 days a week for how much longer, for how long? And how do we get people back to self-sufficient adequately feeding their own families. I don't think that necessarily answers anything, but just food for thought.
Food for thought on food insecurity. Good stuff. All right, Paul and Alice, if you can give me like the 30-second version, I'd really be thankful.
Sure. So just touch upon what I mentioned a few months back was Chelsea Housing. We were looking to, again, we have 8 sites, and in every one of our developments, there's at least one, if not 2 bodegas right within walking distance. And we were looking to partner with Ron Fishman, Healthy Chelsea, MGH, on a grant that would have brought in a facilitator that would have spoken to the residents of the neighborhood of what, to go over everything that Roy was talking about, the healthy groceries, what do they have in their native, countries, and then take all of that information and bring it to the bodega. And then with the grant money, provide the resources for those neighborhood shops to change what they are offering, A, more healthy, and B, more in line with some of the ethnic foods that the neighborhood where they come from.
Thank you. Alice.
I just need clarification. I'm trying to operationalize the first part of G. It says provide access to food storage. So I'm going to vote for that. I'm not sure I understand what that would look like.
So I'll just say this out loud, is one of the wonderful things about this is that we can say, here's what we want, and folks will provide the city through the RFP process creative ideas about how to do it. So in other spaces, for example, for that particular one, in other spaces, there are food storage lockers that people are able to be assigned in spaces that they can access. There are community kitchens that have joint kind of pantries where you can have like a bin with your stuff. So there's ways of doing that. Some of it is shelter-based, some of it is more public space. Community kitchens often have sectioned off places where you can have even cold storage as well as like refrigerated storage and non-refrigerated storage. So there are creative ways to do that though.
Okay,
but there might be some amazing ideas we've never heard of. All right, very quickly, Roy and then Raphael. Roy.
After seeing the list and thinking about what I said, I see the connection between B and having F, because those community kitchens and teaching kitchens will provide the education, and maybe we still have something in our schools.
Awesome.
So I just wanted to add that.
Thank you, Roy. Raphael.
I was just wondering if someone can remind us sort of what the Chelsea Eats program, how much money it gave out per person and how much it cost.
It's ranged from 200 to 400 a month. The cost was roughly $700,000 per month.
For 8 months.
We ran it for 9 months.
9 months.
And it met a little under 2/3 of the applicants.
Yeah, it was around 2,000 households.
And over 3,000 applied.
I love the program, and I love that we were at the forefront of this. I have serious concerns about, how quickly we could run out of the $15 million if we're spending $700,000 a month, and how great of an impact it could have during that time period, but how the balance between short-term and long-term could be out of whack really quickly. And it bothers me because I really like the program, but I'm just concerned about that piece.
Jenny, you had
served everyone who qualified. We would run out of money, all 15 million in a little over a year.
All right. Brother Muhammad is getting on his flight, so thank you so much for your time. We'll get your input, and thank you. Jenny put it in the chat. G aligns with education piece for me. That's another sense, which is in some ways what the education piece that we added to it. So we're going to go ahead and go to Erica in the voting, and she's put up the link. I'm going to stop sharing so that folks can look at their other screen now and go ahead and do your ranking for food security. I'm going to be looking at mental health next. I also want to say that part of the reason we ask you to rank all of these is that there are ideas here that maybe will not get funded by these ARPA dollars, but are important things to do that are important for the city manager and the city offices to be thinking about, and also for all the other places that you touch to also be thinking about. So there could be things that other funds might be able to pay for. So I don't want you to feel discouraged if your idea didn't make it to the top in there. All right. All right. We're going to move to mental health, mental and behavioral health. We've got quite a number of strategies in this one. I'll go over them quickly. A is expand services to those experiencing domestic violence. B is support for youth development programs, including extracurricular activities at low or no cost for students, opportunities for sports recreation outside of school time, community center, youth center, one-stop multi-service center, music lessons. Support, C is support rapid crisis intervention teams and increase social worker services within the city. D is launch a campaign to address mental health stigma and normalize getting help and seeking out resources. E, increase mental health services for 0 to 8-year-olds. F is implement preventive mental health measures and early supports. G is increase number of locations available to residents to access mental health resources. H is support peer-to-peer support for addiction and substance abuse. And I is provide trauma and mental health supports for immigrants and undocumented. So thoughts, questions, anything that you think is missing that you want to see added, and then we can move to advocacies.
Yeah, I'd like to see added, and I thought we had talked about it, but maybe it was just in my mind. And I'm thinking of something that'd be long-term, mental health kind of training offerings within the schools, so the instructors have a curriculum that they get trained in and they offer it to their students. And so it's something that the schools can look into incorporating it. I know there's a school out in the western part of the state that has done that and done that well. We could use that model. That way it's something that is, extended throughout the community, and it could be offered to parents and families and by the community-based organizations, so everybody's getting healthier together.
Now, one thing that I know we noted when the superintendent came and did her presentation was that there were, through the ARPA dollars that the schools get, the district gets itself, they were both hiring more social workers and counselors within the schools and adding to the curriculum offerings for the teachers there. So just to say that that's in there. And this is one of those instances where we want to know what's going on in other places, because all of this is important, as Jenny just pointed out.
So they have the funding for that. They don't need to worry about funding.
So there's ARPA dollars specifically for that as part of the presentation. I can make sure that we can send you the presentation that she shared, so you'll be able to review that to make sure that that's.
I was at that presentation, but did that include anything for the parents and the families and those who don't have children?
No, it really was focused on the curricula at school. So maybe that's a separate one that we can add. Okay. Tara?
The piece in B around like community center, one-stop multi-service center. I'm looking at that as more related to G, increasing the number of locations available. I don't see the, if we could just switch the one-stop multi-service center type community center language in B to put it in
You want
G?
that added to G, because there's two really different ideas there between positive supports for mental well-being and behavioral health, which is B, and then G, which is locations for mental health resources. You want to add the multi-service center piece to G? Is that, I just want to make sure I'm hearing you right.
Yeah.
Okay. Raphael.
I'm struggling a little bit because I feel like there are a lot of things on this list, but it's not comprehensive. I think the biggest underlying problem is that there are not enough mental health resources available for anyone.
Mm-hmm.
And right now, when we go into voting, we have to decide if we want to vote for increased mental health services for 0 to 8-year-olds, which, you know, I'm clearly in support of. But every age group has insufficient resources right now. And so then I'm looking at the option of having multiple locations available. There's no point in having multiple locations if there are not enough providers. So I'm not sure how to fix that, to be honest, but I feel like we really should. I mean, I'm more worried about being embarrassed by when we present this to the community that we voted on these and sort of singled out certain age groups, but didn't cover other ones, than I am about which order we put them in.
Would your suggestion be to add one or expand one of the age groups?
Well, I'm hoping that somebody else can answer that question. Like, can we just say increase mental health services? And if we want to single out certain age groups, we can say including those or something. But Jenny just put it in the chat. You know, just increase mental health services. Like,
I'm on the same with Raphael. I'm thinking, you know, yes, it's important to have it, you know, for as early as, you know, before 8 years, but it feels like we're excluding the rest of the population. I feel that, you know, you want to increase locations. We don't have enough mental health providers with the language barrier as well, right? In the same language that is needed. We're talking about expanding services and adding locations with no mental health providers.
Thank you, Johnny. Got Joan and Kara.
So I was thinking about, and I agree with Jenny and Raphael in terms of, you know, not excluding the rest of the population when you add in 0 to 8. And I also think this is a sea of difficulties in terms of access. Because the reality is there is no access. So with us coming up with the plan, I wonder how effective it truly is going to be, because the picture is so much bigger than what we're looking at here in terms of access. So you talk about it and you bring it to the community, and the reality is it's not available, right? So it's very difficult. The mental health providers aren't there. The lists are very long. Even for the babies to the adults, it's just a tough field to be in right now, or to need those services. But I do want to say something that I think is more we're capable of doing is kind of like a mental health cheat sheet referral information, to kind of like the poison control card, right? To get the information out there, to put it in places that are accessible to residents, as well as business owners, as well as organizations, as well as City Hall, to have that sheet out there, or that card, that quote unquote poison control card, with numbers and resources that you know, folks can get to. Or if business owners, you're seeing these, you know, folks coming into your business or organizations that are really in need of services, but you don't know where to refer them, right? The numbers aren't within reach. So it's kind of like a poison control card type of a referral information that's readily available in City Hall and across the city, as well as schools.
I'd added it to D as part of that campaign to address mental health stigma and normalize getting help and seeking out resources, including rapid referral card. Is that good? Joan?
I'll just quickly add, I love that idea, Joan. It's awesome. I was part of the 0 to 8 being vocal about that population, but I'm totally hearing everybody say, and I agree, if we're going to present this to the whole community, wipe that out, including 0 to 8,
So
although they're always I'm always going to fight for them. And then I think, just to go back to Alice's point earlier in this whole conversation around foundations, like, we have to think back to foundation, like, what's the foundation for mental health for this community? We can't increase stuff because we don't have the bodies and the people in the building to do it. We can do some workforce development around getting people involved in human services and mental health and the social work paths. but that's a whole other story. But I just think that we are also in two phases of a crisis with mental health across the state and seriously in the city. And we also are at a level of where can we put some investment in prevention and education and talking about mental health as part of daily conversations and within all of our works. The barbershops are getting trained in family nurturing program trainings in the city that some people don't even know about yet, but that's happening. So people in barbershops are getting educated around talking to people about more than just, you know, conversations. So deeper. And so just, I think if we go back to some foundation stuff, this is a heavy list for all of us to really figure out and feel good about. But I think if we go back to the foundation piece of where do we invest in?
I just want to make sure that folks are, what I just heard was about taking out the including 0 to 8 so that E just reads increased mental health services. Are folks okay with that? But you want to keep 0 to 8 in there?
I like how you have it in parentheses that it includes that population too, and it's not excluding them, because typically it is excluded. So I like that it is in there. Is it necessary? Maybe not, but it just gives an additional point of reference. Another thing that I would say is on the peer-to-peer, I agree with Rafael. I think he posted before me about adding mental health, not just addiction and substance abuse under H.
So yeah, peer-to-peer for support for addiction, substance abuse is a specific approach, and you know, licensed peer-to-peer counselors by the state. So that's not just you know,
okay.
Not just just want to make sure we're not saying the same.
We need something similar, considering that there are not enough providers. I mean, we heard Cara, we heard Rochelle, and we keep saying, and Joan, we keep seeing that that's one of the biggest issues. We can't fix it. I mean, we're not going to be able to fix it with ARPA, that's for sure. But we do need a peer-to-peer mental health support program, because not only of the big issue we're having with mental health, we're talking about suicide prevention. We're not just talking about substance abuse, addiction, domestic violence. We're talking about people trying to harm themselves as well. So I think it's crucial to have that in there. And lastly, I would say, if necessary, because we want to consolidate as much as possible, I will probably add it to support for youth development programs and others, as peer support as well, because you're not going to have everybody wanting to be part of certain programs because they probably have an underlying mental health condition. They might not want to feel comfortable joining any of the programs. Having one friend that they can rely on will be a good option for youth programs as well.
It's a strategy within what youth programs do. But I think what you're talking about, peer-to-peer mental health supports, is a little bit different than what like the buddy system at the Boys and Girls Club. So just to make sure we're putting it in the right place. If there aren't any other additions or corrections, we'd love to make sure we get a chance to rank these and hit environmental health. So just checking in, seeing if there's any other advocacies before we move. All right. I do want to say this as we go into ranking these. You know, this is a gargantuan issue that you're trying to do a small part to address. So, you know, even if we put all of the money into this, the entire 15 million into it, it wouldn't be enough. So really be thinking about how do we do some things that leverage some greater good and creates a path for some good things in the future from these dollars, knowing that there are need to be other investments in it as well. All right, so Erica, I'm going to give you the screen and send folks off to ranking this very long list. And that's going to take you a little while because it's a long list. Before we go to our last section, Roy, if you want to chime in, go ahead.
Yeah, I just want to say this. I'm going to tell everybody, I actually put services to immigrants and undocumented at the bottom. And the reason, as I was reading the list and going forward and saying, provide this type of service, support peer-to-peer, increase assistance for domestic abuse. In my mind, I would think that whoever we hire, whoever we are adding or funding, that if they're working in Chelsea, they would already include an idea that, okay, we are working in a community that is immigrant, and reaching to the community, that community would be an overall plan, so that if I say help them, try to address domestic abuse, it's not going to be, different. It's going to say we have to take into account that we are in there. So I just thought that if I'm hiring, a servicer to come in, that they would come into it thinking already, how do we take care of everybody, instead of specifically saying undocumented and immigrant. So that's why I was, I put it that way, but I didn't see it till I went through the whole process, and I just needed to make that, say that observation.
Part of why it was called out explicitly, and I welcome your amendment there, that all the things that are at the top, we should have that in there explicitly, so that folks are sure to include immigrants and undocumented and all those other services. That makes complete sense. Kara's comment's really important, that often access to mental health is dictated by health insurance access, and the opportunities are there. Are meted out based on that insurance. So anything that we can do to support access that isn't tied to health insurance is important. Great. I'm going to move us very quickly into the last one for the evening, environmental health. Certainly, this isn't any less important than any of the other ones. I'll read over them briefly. A, increase the amount of open space, parks, and active outdoor spaces. B, support renovation of homes to improve windows, ventilation, decrease noise pollution. C, support indoor and outdoor efforts to mitigate industrial and vehicular exhaust. D, support pest control and mold mitigation within housing stock. E, increasing street cleaning, sanitation in public spaces, and pest control. F, develop programming for homeowners and small landlords who may need to renovate to bring housing up to code. And G, develop bike path to connect Chelsea to Boston. I know that there's some advocacy that was emailed in. We'll add that into the advocacy, but before we go to advocacy, want to see if there are any comments or any additions, anything that people see as missing that you want to add or edit. Jenny.
So I see the increased amount of open space, parks, and active outdoor. I don't see anything about education, about, environmental health and protecting whatever trees we have left, because there's so many buildings in the city. There is nothing about educating the community about living in a hot island, right? I would like to see something like that. I would like to see more education around protecting parks, about taking care of the environment, making sure that we are aware of where we live, or where residents live, and how they can make a difference in the environment, in the in the air that they breathe, by protecting not only parks but the trees, all of that. I would like to see that in there. That is not there.
Okay.
As you know, I'm going to be a strong advocate for A, but I feel that a bike path to Boston is awesome, is great, but I much rather breathe good air. I much rather have a park to go and unwind, which helps with mental health. I much rather know that my,
there are advocating Not
Huh?
putting other, we're advocating, not putting ideas down. So
Oh, okay. No, I know.
appreciate
But I'm saying, I strongly feel that we need to,
Hey,
more needs to be done on that. And I didn't see it in here and I wanted to see it.
so we put in increased education about environmental health, capture.
Yeah, increase education about environmental health and, you know, taking care of the little trees that we have in the city.
All right, Joan and then Kara.
Yeah, I like E in terms of increasing street cleaning, sanitation and that, but I'd like to see more of the responsibility of storefronts and business owners in terms of being responsible and keeping that space clean. So the litter is just so overwhelming and the DPW can do so much, but I just would like to see added to that piece is an initiative in terms of storefront or businesses being responsible for their space and even homeowners, just to be more responsible in terms of litter. Yeah.
Kara?
Just quickly, I would just add I see like D and E as kind of public health issues versus, I mean, they have an environmental impact, but and I appreciate the increase in education about environmental health. I would say, you know, for the entire community, that it's not a natural knowledge base for people to have an understanding of why do we need more trees in the city, or what are we going to do about if the Chelsea Creek or overflows or floods us, or 2 weeks worth of 100-degree days in the city and how we cook ourselves. So the education piece to me is crucial in what the future is going to be bringing us. And that's been all over the paper this week too, around rising waters, and Chelsea's on the water. It will be waterfront, and some areas may have waterfront property prior to them being ready for that. But I just think there's a little bit of a mixedness of public health issues versus environmental issues on this list.
Rick?
Yeah, just a comment on the litter issue. I mean, the DPW does a very, very good job. The issue is that I think you need education telling some of these young people, there's barrels every half a block to use the barrels. And can't tell you how many times I see a car pull up, they open one of the doors, they shove everything into the curb of the on the street. So there's only so much business owners can do. There's only so much DPW can do. It's just an education process of maybe starting in the schools that you don't litter. That's all I'll say on that issue.
Now, there's a really good precedent of a project that focused on littering in public space in Texas that really affected how people took care of their community. So there's good evidence that can have an impact. Thanks, Rick. Appreciate that. Any other thoughts or advocacies for anything on this list?
Can we add planting more trees or protecting the ones that are already in the park? I know I said education, but like I was saying, the population itself is not educated on how to protect the plants. But planting more trees is probably going to help us a lot in terms of the air that we breathe, and is also going to give us some solace in the rising waters and the temperatures, some breeze.
Other thoughts or any advocacy? Rick, is that your hand up again, or was that from the previous one? No, okay. Any other? All right, so I will take these off of here, and Erica, you'll let me know when you're ready to roll. once we're ready and have all those options in the poll, we'll open that up. We'll do our last poll, and then I'll have like 1 minute at the end just to tell you again what's happening next, so everyone's ready for when we see each other again in a month. Want to say thank you for folks for hanging in there with us. We're almost done for the night.
So everyone is invited to attend the community meeting.
Yep.
And
Yep. Say
listen
that too.
firsthand.
Yep. Erica, let us know where we are. All right, the link is in the chat. Go ahead and hit that link, and we'll see our last ranking here. Last 4 minutes. Let's take the 4 minutes and we'll be done. A few weeks will bring. We will take the summaries of these, make available to you what the raw vote was, so that we're absolutely transparent about what came in first, second, or third, and so forth. We'll be taking these ranked versions to the public meeting on March 2nd. We'll be using that public meeting to allow folks to give comment on the strategies. They will also have an opportunity to give us a sense of how they would like to see the dollars apportioned by the buckets, so by category, so housing, food security, mental and behavioral health. Our hope is to be able to meet with City Council the week after that and get their input as well. We'll bring all of that back here for you all to look at on the 16th and to finalize. And when we finalize the set of strategies that are being considered for investment, we'll also ask you to do a process. We'll be in person on the 16th of March. Holding out, inshallah, for you to also give some guidance on how the resources are distributed across those strategies. So thank you all so much.